I rise today in support of the motion to condemn the Cook Labor government for its failure to make the failing health system its priority. So let me be very, very clear. This is about patients, this is about nurses, ambos, doctors and the allied health staff doing their best with what very little they've been given. And it's about the people of regional Western Australia who are simply asking for the same access to healthcare and emergency services that others in this state have access to. I represent Warren Blackwood, a proud region, a growing region, one of the fastest growing regions, a region that contributes to this state's economy through agriculture, forestry, tourism and community leadership. And yet when it comes to health infrastructure, we are being left behind, forgotten and ignored. So let's begin with the Manjimup Hospital, a regional hub servicing a large and ageing population. Despite repeated requests over numerous years, there is still no CT scanner at Manjimup. This is not a new issue, it's not a vague idea, it is a clear clinical gap that has been formally raised by local doctors, documented in correspondence and highlighted through budget estimates. A local rural GP put it plainly. Due to the needs in inter-hospital transfers, our patients cannot access timely imaging, limiting their treatment options and reducing the likelihood of a full recovery. Stroke patients are missing the window for life-saving treatment. Trauma patients are being shipped hours away for scans that could be done locally. And our nursing workforce and ambulance volunteers are being stretched thin by needing to escort the patients for every transfer to those hospitals. Manjimup doctors have asked for a CT scanner for years. Where is it in the $1 billion investment program? No line item and no commitment. In Margaret River, it's a booming town and a tourism hub, yet its hospital is showing signs of neglect and underinvestment. The Labor government has developed a business case for hospital upgrades, but won't release it. Recent correspondence from local residents, John and Di, paints a troubling picture after a 9-week stay in the hospital. There was a main light in the patient room broken for 8 weeks, despite a work order. A ceiling in another room with a reoccurring damp patch every winter, patched every year instead of fixed, but there were no mushrooms yet, Lockie. Disabled parking bays on uneven ground making access difficult. Call buttons that sometimes fail. Entire wards carpeted, raising hygiene concerns. And this one here, there was no patient hoist available on arrival, and they were told that they had to wait because it had to arrive from the Augusta Hospital, which was 50 kilometres away. And whilst these faults mount up, there are nights with only one nurse covering 10 patients, sometimes also assisting in the emergency department. This is in the region the state government heavily promotes as a tourist destination, yet it will not commit to long-promised upgrades. Instead, the Premier said the people can drive to Bunbury Regional Hospital to access healthcare. In Bridgetown, the situation is bordering on the absurd. The roof of the emergency department is leaking. Patients arriving for emergency treatment are being seen under a roof that needs replacing. The estimated cost to re-roof this section is $1 million. In the context of this government's $1 billion infrastructure program, that's less than 0.1%. So we ask, is it funded? And again, no clear answer, no line item, no transparency. Acting Speaker, what kind of government allows emergency care to be delivered under leaking ceilings? And it gets worse. In February, the government made an election promise to deliver urgent care clinics across the southwest, including Warren Blackwood, to relieve pressure on emergency departments. It was in writing, a commitment to deliver urgent care clinics in the regions. Now, with the 2025-26 budget handed down, we ask, where are the clinics? What is the timeline? Which towns? What funding? Still no answers. The same applies to ambulance and patient transport services. Despite regional demand increasing, the forward estimates show a decline in funding year on year. We ask for the assumptions behind this. How will the service levels be maintained? Are the cuts being covered somewhere else? Again, nothing but spin. So let me bring this down to what it means on the ground, in the real world. When a mother in Manjimup has to drive nearly 2 hours one way to Bunbury for her child to have scans done because there's no CT scanner at her local hospital, that's not world-class healthcare. When an elderly man in Bridgetown has a fall at home and arrives in an emergency department only to find a bucket under a leak in the roof, that's not world-class healthcare. When nurses in Margaret River work double shifts in crowded facilities with no communication from government about overdue upgrades, that's not delivering for the regions, and it's certainly not world-class healthcare. And when volunteers, the very backbone of our rural ambulance services, are forced to transport patients for basic scans or emergency needs over long distances because the government won't invest basic needs of in local hospitals, it's an insult to the communities who keep the system running. And that certainly isn't world-class healthcare. Our ask is simple. For all West Australians, and in particular the people of Warren Blackwood, we are asking for basic, timely and safe infrastructure to support the health and dignity of the people of Warren Blackwood and all West Australians. Our requests are not new. Fund the CT scanner in Manjimup, fix the leaking roof at Bridgetown Emergency Department, commit to infrastructure upgrades at the Margaret River Hospital, honour your election promise to deliver urgent care clinics, and reverse the trend of declining investment in ambulance and patient transport services. These are practical, costed and widely supported initiatives. The doctors support them, the nurses support them, the community supports them. The evidence backs them. So, Acting Speaker, we do condemn the Cook Labor government for its failure to prioritise health over racetracks. But more importantly, we call on the government to act decisively, transparently and fairly. Because when it comes to health, delay is not an inconvenience, it's a risk. And regional West Australians are tired of being told to wait. Thank you.
Thank you, Member.